students. So next topic is Cushing syndrome under endocrine systems disease. So let's get started. So the introduction says that the Cushing syndrome is a problem. It occurs when there are high levels of hormone cortisol is being secreted. Okay, so Cushing syndrome, or we can call it hypercortico or cortisolism, is a cause of oral corticosteroid medication also. If you are taking that medication orally, even then you can have this problem. Okay, so this condition can occur in your body when there is an excess of cortisol hormones in your body, either by taking it through medication or whenever it is going on to be increased by its own. Okay, so the symptoms I have classified into three main differences, that is the common, male and female. So the common symptom says you can see a person gaining weight, there will be an excess of fatty tissues on his body, and there may be more deposit of fat around the midsection or the upper back or his face, which look like a moon face, and between the shoulders when it looks like a bump of buffalo. Okay, so the second symptom says that there will be pink or purple colors stretch marks on the skin close to abdomen, thighs, breast or arms, and your skin will start to become thin and very fragile, that even a small line can become a small bruise can become a big lion. Okay, so there will be slow healing of cuts or insect bites, and there will be acne. If we talk about males, then they will have these three main conditions, that is the erectile dysfunction or loss of sexual interest and decreased fertility or infertility. If we talk about females, then there may be hirsutism, that is the more visible facial hairs on the face, neck, chest, abdomen or thighs, and irregular or absent of menstrual periods. So the causes, if we talk about, so the symptoms of the Cushing syndrome, they are caused by the damage to the body tissues. Okay, and that is because of high levels of cortisol. So the disorders that trigger high cortisol levels include tumor of pituitary gland, tumor of adrenal gland, then ACTH tumors or ectopic problems, and multiple endocrine neoplasia or glucocorticoid hormone therapy. Complications, if we talk about, then the Cushing syndrome may have complications like osteoporosis, that is the bone loss, or hypertension, or type 2 diabetes, and there may be frequent infections and loss of muscles and strength. The diagnosis can be made according to the cortisol's level. So physical and visual examination is the first source. Then according to the hormones, there may be the different checkings through the lab tests, urine tests, and some MRIs and CT scans to check the size or the evidence of any tumors. So treatment, as I've already told you, endocrine system has the treatment according to the symptoms and sign, but it is usually same, that is surgery, medication and radiation. So this is it. Thank you. We will meet again.